The beauty of Cyberknife, there's no knife at all, but rather image-guided radiation beams destroying cancer cells with targeted precision anywhere in the body with sub-millimeter accuracy. UNC Hospitals operates one of only 3 Cyberknife systems in North Carolina.
And it has a small or miniaturized linear accelerator attached to it. The robot is powerful enough to move the linear accelerator all around the patient, and that means that the radiation can be delivered from many different angles with tremendous accuracy. When we give radiation in the brain and deliver it very accurately or very precisely, we really do come within a few millimeters of very important structures, and we have to be confident that we're killing the tumor without damaging those normal structures.
At UNC Hospitals, Dr. Matthew Ewend treats patients with brain tumors. Before the Cyberknife, traditional radiation treatment required immobilizing his patients' skulls with invasive pin-based rings.
Cancer patients are very brave and they do what they have to do for treatment. We're just pleased not to have to use this device anymore. The Cyberknife, rather than relying on the patient not moving, recognizes that the patients will make small movements, but it has built-in detection device. It uses X-rays to track the patient. And since the robot can move around the patient, if the patient moves their head a little bit, the robot just moves and corrects for that.
Here's how it works. The physician identifies the tumor to be targeted and healthy tissues to be avoided. Cyberknife software generates a treatment plan to provide the desired radiation dose to the tumor. Before each beam of radiation, the Cyberknife simultaneously takes a pair of X-ray images and compares them to the original CT scan.
So if the patient moves, each X-ray will change, and then the computer can solve how the head must have moved. And if they've moved, the robot corrects for that, and then it shoots the beam.
This image-guided approach continually tracks, detects, and corrects for any movement of the patient and tumor throughout the treatment to ensure precise targeting. Dr. Ewend says the Cyberknife treatment of brain tumors has an 80 to 85% control rate.
It's equally successful as if a surgeon went into the brain and removed the tumor, but it spares them all of the invasiveness of an open surgery.
When treating lung cancer patients, the system tracks by using markers.
These little white dots that you see are the markers that are placed in the lung near the tumor. And then as the patient breathes, the X-ray can track these markers as well as the ribs and the spine and localize exactly where the tumor is throughout the respiration cycle. And if you watch the Cyberknife while it's treating, the patient will be breathing and the machine will just be moving right with the respirations.
Cyberknife has become a pain-free, non-surgical option for patients diagnosed with previously inoperable or surgically complex tumors in different areas of the body.
Now we can treat lesions in the liver, in the lung, in the prostate, breast cancer, in the neck and bones, so we can treat anywhere in the body because we can take an X-ray anywhere in the body.